Hello, and once again, welcome to this installment of our Innovators series. I'm Jessica Pumo, Vice President of Marketing here at Tallwave, and today I'm joined by Dylon MacEachran, Vice President of Marketing and Communications at Atlas Healthcare Partners. At a high level, Dylon, you shared that your two main responsibilities are driving organizational growth and stewarding Atlas's company culture. On the growth front, I know you're responsible for growing the organization from a marketing perspective and helping health system partners expand their ambulatory service footprints and building a pipeline of surgeons and physicians, as well as differentiating Atlas in the market. And all of that is, of course, underpinned by culture, which is the foundation of Atlas's business model. On that front, I know Dylon works to ensure Atlas's values are communicated and integrated at every level of the organization, both internally and through the work that they do with their partners. Dylon, welcome, and thank you so much for joining us today.
Thank you, Jess. I'm really happy to be here.
Well, I'd love to kick things off by learning a bit about your professional journey. I know you spent a number of years in the healthcare industry. What initially attracted you to this space and what drew you to Atlas specifically?
So many years ago now, I was actually in sales and not at all related to healthcare. And through the sales journey, I really fell in love with marketing. I wanted to create something that helped me to sort of get, information out to market and really make greater change than on a smaller scale that I was experiencing as a salesperson. So I went back to school and got my master's degree in business administration. And from there, really, it was a blank slate. And I actually joined a branding firm that specialized in healthcare. I was interested in learning about branding from the larger marketing perspective. And from there, it really grew. I spent a couple of years with that organization called Monogle. They're a branding firm out of Denver that specializes in healthcare. And from there, went into marketing, product marketing with Health Grades, eventually spending some time with Dispatch Health, which is an urgent care business that takes urgent care out to a person's home. And that's really where I came in contact and spent a lot of time learning about ambulatory business. So really anything healthcare related that's outside of the hospital. And I really love the space. I find it to be very interesting. It's complex. I think it's fantastic for healthcare. It's a great way to reduce costs, to provide exceptional care to patients. And I was looking for a bit of a change, moving from Colorado to Arizona, and was introduced to Eric Burke, our CEO, who is just so passionate about ASCs and about providing great care to patients at lower cost, while also really serving physicians in a very valuable and important way in healthcare. And so I joined Atlas a couple of years ago, and I'm so happy that I did. It's just been a wonderful journey and experience.
Well, thanks for sharing that, Dylon. And you did sort of touch on this as you were describing your journey a little bit, but I know that some of the terms that we're going to be mentioning a lot in today's conversation may not be incredibly familiar to our viewers and listeners who are outside of the healthcare environment. So I know we've both said ambulatory service centers a couple of times now, which we'll refer to as ASCs throughout the conversation today. Can you give us some insight on the trends that have been driving this market and just define a little bit for our audience what an ASC is?
Absolutely. And a great question. When you're not in healthcare, we throw around a lot of terminology. Even when you're in healthcare, it's hard to keep track sometimes. So an ambulatory surgery center is a surgery center that is not within a hospital setting. So it may be on a hospital campus, certainly, but it doesn't require an overnight stay or anything that you would have to be an inpatient within a hospital for due to that procedure. So these are outpatient procedures, and they are, things that can be done very easily without needing a lot of the the required technology that a hospital, can provide. So, I often say that hospitals are for very complex, sick people who need, big surgeries or procedures that are going to take, some recovery before you're even able to really transition home. An ambulatory surgery center provides a place that patients can go to have procedures in an outpatient setting. And what that means is that they're often less complex. They don't require that additional recovery time, and they are less expensive. So as with nearly everything in healthcare, outside of the hospital is going to be less expensive than inside of the hospital. And so when you are getting a procedure done, or even if you think about an emergency room situation versus an urgent care, that's something that most people understand. An urgent care is going to cost them less than an emergency room would. So same thing with an ambulatory surgery center. You're going to have lower cost. We still have the same excellent quality and care for every single patient. It's often more convenient for the patient and for the physician. And so it can really be a win-win for everyone involved to have a procedure done in an outpatient setting.
Gotcha. Absolutely makes sense. Cost, definitely a factor, but convenience and comfort may not necessarily have been top of mind. So it's good to lay all of that out. Given those market forces, it's not surprising then that more and more health systems are interested in ASC, and payers are increasingly supportive of this trend, with major players like Medicare and Medicaid increasing the number of procedures that can be performed at ASCs and get Medicare reimbursement. Given the increased appeal and those market forces, how does Atlas differentiate itself in such a growing market?
So it's a great question. There are a number of things that we do, I think, that help to set us apart. One of the most important things that we do is we truly integrate with our health system partner. We really understand what it is that they're trying to achieve, not just from an ASC specific strategy, but also ambulatory in general. What is it that they're looking to do from a larger ambulatory strategy? And it's important to keep on top of, the trends that are happening, not just in ASC, but with regard to that shift that patients are making outside of the hospital. And that's been happening for a while now. It happens for a number of reasons. And you asked about the trend toward that. And again, it's not simply with ASCs, but you're really looking at the cost, the convenience, but also the technology. So as we look to differentiate ourselves in that space, as there's more and more of that shift happening to ambulatory, it's important for us to understand our partners' overall goals and how ASCs can support those goals. And so we work very hard to understand as much as our patients, as much as our partners want us to be a part of. So we join meetings from an ambulatory strategy perspective. We look at all the things that are going on for our health system partners, and we really try and meet them where they are and create a growth strategy that works within that larger ambulatory and, quite frankly, health system strategy. So that true integration, I think, is the thing that sets us apart. And we do that from a number of different perspectives. It can be the way that we structure our ownership at each of the ASCs. It can be the way in which we structure our meetings, making sure we're gathering the right information. It certainly is the way in which we look at the overall growth trajectory when we start to say, what's the right fit for the community? What's the right fit in terms of the right service line, the right size of the ASC? So everything really comes back to the partnership. And I think that is what helps us to differentiate ourselves from other ASC management companies.
I know, and we'll definitely circle back on the topic of integration. I want to dig into that a little bit deeper, but I'm recalling something that you shared with me in a prior conversation, and it kind of boils down to our shared perspective of how inextricably linked customer experience and employee experience really are, and how Atlas has applied their very customer-centric approach internally. I would love to hear a little bit more about how Atlas has approached that and what they've done for their employees.
Sure, absolutely. I mean, we don't want to give away the secret sauce, right? But but our operating model is key to everything that we do, whether that be at our support services center, which is what we refer to as our headquarters, or out at each one of our ASCs. So our operating model starts with culture. It's culture first, because on that culture, we then build service. And from great service comes growth and profitability. And so what I mean by that is that, when you think about the Atlas mission, our mission is to provide exceptional care and outstanding customer service to every patient, every physician, every time. You can't do that if you don't have great leadership, if you don't have engaged team members who are there and wanting to provide that exceptional service. So in our operating model, which we look at as a pyramid, the base of that pyramid is our culture. And that means that we look at everything from work-life balance, well-being. That means that we've got to look at what our benefits look like, how we care for our people, how we reach out to them. We don't refer to our team members as employees or staff. They are team members. We are all part of Team Atlas, and we treat everyone as though they are a team member or a colleague. So everything that we do really starts with culture, and that's at the ASC level as well as at our support service center. And we call that the support service center because we're here to support those who are supporting, physicians and patients. I'm not in patient care. And so when you look at the mission to provide exceptional care and outstanding customer service to patients and physicians, I don't do that, on a one-on-one basis, but it's my responsibility to support those who do support it. And so we talk a lot about our culture, and from a good, strong culture, that's how you achieve that service. And that's how you really get to that true integration. That's how you get to providing that service to patients and to physicians, and quite frankly, to one another, because only when we have that level of service are we really able to reach the growth and the profitability. Those things come. They naturally come if you have, exceptional service on a regular basis and people can trust you to have it.
I love that concept, that delivering on your brand promise fully really begins with doing that for your employees. Absolutely. And even when the links aren't incredibly obvious or there are multiple links, all of it is connected. Certainly, you've provided some great examples of how your culture is really aimed at delivering that for employees. And we've highlighted some of the other audiences that Atlas serves. So I'm just curious, how does Atlas operationalize its culture and its values with the rest of those audiences, knowing you are serving patients, you are serving healthcare systems, you're serving surgeons and physicians? Given the diversity of those audiences and their unique needs, how do you ensure they're all effectively represented and supported within your organizational level mission and values?
That's a great question. And I will say it's not easy. But it is, and nor is it aspirational, because we do it every day. I mean, we are able to deliver. And I think, the way that we do that is, again, coming back to the core of, having great culture, having a mission that everyone understands and believes in, and then having a set of operational values. These are values with which we work, and we talk a lot in our stand-ups. We talk a lot in our process when we bring team members on, about the values of the organization, and we'll have workshops that say, what is your favorite value? Or when we introduce a leader or something, they'll talk about what their favorite value is. So we operate within a core set of values, and that's kind of how we standardize it. It doesn't mean that you have to do the exact same thing every time. The way that we look at the business is each individual ASC has to run as an individual business. So we're not going out and saying like it must be done the exact same way. We sort of give a cadre or a system. We give a framework, and then there's flexibility to work within that framework. And so we really come back to our values, and this is how we communicate and how we share, information across patients, physicians, health system executives that we work with, and internally with each other. And I think it's really, really important that we start with the internal communication and how we work together, because that's what goes out and that's what's felt by the audiences that we work with externally. And so when we talk about our values, we talk about integrity first. As you can probably imagine, within healthcare, there's a lot of regulations, and ASCs are definitely highly regulated. There are a lot of things we have to be aware of. We always do the right thing. That's number one. Then culture. So culture is not only a part of our operating model, but it's also one of the values in which we really make sure that we're constantly thinking about that. We are a team first and foremost. Teamwork is our third value. And so, as I mentioned previously, we don't refer to one another as employees or staff. We really talk about one another as our colleague, our team member. It really comes down to respect. We have respect for one another, but also obviously for our patients, for our physicians, and for our health system partners. And then results. Results are key. None of this really matters if you're not getting results, if you're not growing, if you're not showing that profitability. And so we have that out there. We know that if we operate within these things, we're going to have the results. And if not, we've got to figure out why, because that's why we're all in business, is to get the result at the end of the day.
It's such a good reminder that culture is not an initiative that has a stop and start. It's not a grand gesture. It's how you are showing up, how you're communicating with, how you're treating every partner internally and externally in every interaction every day. A good reminder for all of us. Now, I know Atlas is very fast growing, and its stakeholders are located all over the country, which certainly adds some complexity. So how do you maintain this type of culture that delivers on your mission in the face of rapid growth and geographic distribution?
Yeah, it's a great question. We do it through a strong communication plan, and we do it through easy access to our executive team. And so right now we have ASCs in the greater Phoenix area, which for any of your listeners who are familiar with Phoenix is quite large. We have an East Valley, we have a West Valley. We're also expanding our services down in the Tucson area, so Southern Arizona, and in Northern Colorado. And we will soon be expanding east of the Mississippi as well. So we do have, a very disparate team. And one of the things that we do, again, to go back to culture, one of the greatest things that we do is we hire exceptional leaders. And I think that that's key. That's key to having a great culture, is that we hire leaders who are as committed to culture as we are. And they're creating culture at that ASC level. They're creating their own culture. And so if they are, one of the things that we want to do is we want to give back to our communities. But the community in Northern Colorado is very different than in the West Valley of Phoenix. The needs are different. And I'll give you an example. One of our ASCs recently did a water drive. And so they did a drive. This is in the West Valley. They they put out the call to the team members at the ASC and said, bring in cases of water, and we're going to go and donate it to a shelter because it's hot in the summertime here. Something like that wouldn't necessarily work in Northern Colorado, and they do a number of things in Northern Colorado. But that's just one example of, they do different things that match up to the culture of that ASC. As we look to, do different, we'll try and get different contests going. Everybody loves a good contest. And so for maybe a safety survey or something, we'll put out a contest for all of the ASCs to, compete for. And what what the contest is for is very different based off of, the ASCs. So we have some ASC team members who absolutely love Starbucks. Their addiction to the brand and to the coffee is very real. And then we have other ASCs that they don't, if you were to offer them a $5 or $10 Starbucks card, they'd be like, well, it's just not for us. So understanding those individual cultures and really customizing that and having that autonomy to be able to have a culture that is their own, I think that that's part of our overall larger, Atlas culture and Atlas mission is to kind of be who you are. And so we do that at the individual ASC level. And that really comes from the leadership and how we communicate, who we are and what we do at a greater sort of Atlas level.
It's an interesting notion, right? This idea of making it authentic, which means making it personal and individual, but still something that's unifying for Atlas as an overarching brand. I'd love to kind of apply that same thinking to partnerships outside of Atlas. I have to imagine that partnering with other large scale mission-driven organizations like healthcare systems certainly represents its own unique set of challenges. How do you solve them to ensure cultural alignment and delivery of the same vision and values while still recognizing and respecting those differences?
Yeah, that's one of the, I think, the more fun challenges. One thing that ties us all together is healthcare is very mission driven in and of itself. A lot of us get into healthcare because we want to do the greatest good at whatever level we're able. And so the idea that we're all in it to do good is already there. It's a good starting point. But we do a lot to make sure that we crosswalk our mission before we get into partnerships. We really do a lot of analysis to make sure that before we go into to partner with anyone, that we're all on the same page in terms of culture. We partner with Banner, and we manage all of Banner's ambulatory surgery centers and their growth strategy with the ASCs. And the Banner health mission is to make healthcare easier. When you look at our mission to provide exceptional care and outstanding customer service every time, that certainly is easier, right? That doesn't mean that it's going to be difficult for you to have a great service. So their mission very much supports ours, and our mission very much supports theirs. And then when you start to get into an analysis of looking at either a group of physicians that we're going to be partnering with or another health system that we're going to be partnering with, that's where a lot of the early conversations come down to what are the values. And I go back to integrity being a big one. We do operate first and foremost with integrity. We look at everything from every angle and make sure that we are doing it in the right way, and that we're not taking any shortcuts. And I think that looking at it that way and creating from the very outset, the very beginning, whether we're responding to a request for information with a new health system, or we're doing a study for a physician group on whether or not an ASC in their area makes sense. I think we start with that core set of values, and that helps us to really look at what are their values, what is their mission, are we able to crosswalk? And if we're not able to crosswalk, we don't partner. We just don't. We really make sure that there is a good fit for both parties before we move forward.
So crosswalking your values is a great concrete example of one of the lenses through which you're approaching the partner vetting process. I'm just curious about what some of those other lenses look like. How else are you evaluating the fitness of potential partners for Atlas?
Yeah, so results being one of our values, we are looking at the best in class, quite frankly. We ourselves are, we're a competitive group. Our executive team is a competitive group of folks. We like to win, and we want to be able to help others win too. And so we're looking to see, what is the size of the group? What is the potential in terms of growth? What are the goals? And do we feel that we can, one, meet them, but can we stretch them? So a lot of that comes from those conversations and that deep integration that starts, again, from the very beginning to understand with a health system executive, what is your long-term vision? I will say, we have no interest in being a vendor. And I think that that's another piece to answer an earlier question that you had, what differentiates us? What is it that makes Atlas different? We don't want to be a vendor. We want to be a partner. We want to be a true partner. And that means that we are tied together. Our success is their success. And so we look on the outset, how strong is the health system? What is the longer term vision for their ASC strategy? Does it include some of the really interesting service lines that are coming up that could help patients in their community, something like cardiovascular? So we really are looking at it from a larger strategic partnership perspective and longer term. Who is going to be able to stick with us over the next 10, 20 years? Not something that's just going to be a couple of years where we were a good vendor for a little while and then we all move on. So those are we really look at size. We look at quality, certainly. What is the quality of the healthcare that they're providing? What are the things that the community is saying about the organization? And when we spoke earlier, we were talking about this and the way that it all ties together. We have to look at, when we look at partnering with a health system, what is the sentiment in the community for that health system? When we partner, we want people who are going to be local to help us lead the ASCs there. And so if there is a health system that doesn't have a good reputation, that's going to make recruiting our leadership very difficult. And it's going to mean that, we have to recruit people that maybe not be as aware of the health system or that are okay with some of the things. So it all ties together in that if culture is our guiding principle, and that is the base of all we do, and we will be recruiting great leadership to lead that culture and deliver on the service for the ASCs as a part of that partnership, then we really have to look at the beginning and on the outset of that partnership on what is the sentiment, what is the clinical quality, what is the integrity of that partner, and are we already starting on a good foot in order to be able to deliver on our promise by the time everything shakes out.
So partnering with the right groups, obviously foundational to this success. And I think as you and I have kind of talked about it here today and in a prior conversation, it's partnership with a capital P, right? This is really something other than a traditional business partnership. I feel like it's something bigger because Atlas and the health systems that it partners with are really in a position to mutually deliver on one another's brand promises, which is a big thing. So beyond the initial vetting process, once you've kind of identified that the fit is right, what is the overall process for becoming truly deeply integrated, as you've described, with a partners team at a deep enough level to do that really effectively?
Yeah, so I think again, it comes down to making sure we have the right personalities in place to be able to integrate into those health system partners, and ensuring that there's trust. We build trust from the outset. We are interested in learning as much about the health system strategy for growth, and for caring for their patients as we possibly can be. So we are, as I said, we partner closely with Banner Health, and one of the things that we have done is truly integrate into their ambulatory strategy and their ambulatory overall growth and profitability strategy. And so a lot of times, our executives are asked questions that may not necessarily have anything to do with ASCs, but we're a trusted member of the team. And so it's, their perspective is valued. Their many years of service, decades of service in healthcare and in understanding ambulatory, in addition to ASC and health systems, are, that's very valuable. And so we've built that trust over, years of working with them now. And we do that, again, from the outset. We make sure that the people who are going to be supporting those health systems or those physician partners are, they're trusted. They come from a long line of health system success or healthcare success, and they are, able to build that trust and be a partner, as you say, with a capital P, in helping not just within the ASC space, but the overall strategy of the organization. So that's just really important to us to be able to do that. And we do that with again, starting with culture and getting the right people in place to be able to drive that trust and to have that in place. And that makes everyone successful. When our health systems are successful, we are. That we don't structure anything to where we would be successful without them, or vice versa. So I think that creating that trust and that accountability is key. And I agree with you. I think that it's hard to talk about at such a surface level, but partnership doesn't really feel like the right term. I mean, I don't know if marriage is the right term or not, but it's probably a little closer.
Absolutely. It feels inadequate to describe the depth that we're talking about here. You've kind of touched on this, but I want to just kind of go at it directly. I think alignment of vision, alignment of mission, alignment of goals are all really important for building the kind of trust that you're describing. And I think it's often very difficult for cross-functional teams to create a shared language and define success and KPIs in a common way. And I know, as you've described, it's really important that you're all rowing in the same direction and that there is a shared definition of success. So how do you identify and measure value delivered to each party? And then how do you continue to create and add new value over time in a shared sense?
Yeah, it's a great question. So I think you do have to come back to the goals that you've set out. And it's really about, are we achieving the things we set out to do? And there are a number of ways that you can look at success. Certainly, profitability is obviously one of the biggest. are we making money? And that's that's an important one. But all along the way, if you're getting closer to that point by looking at a number of other goals that you set out. And those goals are specific to the health system. They're specific to each individual physician. A physician that is looking to partner with us to, ramp up their income, to pay off, student loans, to really increase, their profitability. I think that is very different from a physician that has been in the business for a really long time, maybe doesn't want to necessarily be an owner, but wants to utilize, an ASC that is going to help him, with his reputation and making sure that, the patient's experience reflects on that physician. So when you talk about, what is the common set of what's the language, what are the shared terms, it really depends on the audience. We have a number of audiences and we have a number of customers, and it depends on what it is that they're looking to do. And so I think it's important to understand that what we do that is different is we talk with our partners about what are your goals? What is it that you want to achieve? And we then set out to achieve those together. So in order to reach that ultimate goal of profitability, let's say for the health system, we have to look at the goals that we set out for their growth. Do we have the number of ASCs that we looked at in the region to say this is the right number to serve the patient population? Do we have the right set of service lines? Are we, if we have, too much ENT, ear, nose, and throat, but not enough orthopedics, what does the patient population in this area need most, and have we delivered on that? And we know we've delivered on that when there is growth, when when we have enough procedures, because that's what the physicians are needing, because we're meeting their needs. So it really does come down to the individual partner and how we set out those goals and what that shared language is within the goal is, and how we get to that eventual success rate, that success metric.
I love the reminder that there are a lot of other KPIs, a lot of other goals that have to be met kind of further upstream in order to arrive at that destination around profitability. And what those goals look like will vary based on the audience, but all of it is sort of interconnected, and you've got to hit them all along the way.
Yeah, it's really key. And, and again, when you look at our operating model, growth and profitability are at the very top, but those truly are lag measures. We will be successful if we have, the right care, the right service for our patients and physicians, our health systems, and one another. And that comes from that culture. So we can't, I can't say it really enough, because the profitability is the end sort of goal, but all along the way, there are these amazing things that happen from a culture perspective, from a service perspective. We every month we gather something called mission moments from our ASC leaders, and they will send to us stories of moments that have happened within their ASC where we've provided exceptional care or outstanding customer service. And that could be exceptional care to a patient or to a patient's family member. It could be, something we did to go out of our way to provide that, that customer service for a physician. And these are things that happen on a daily basis. We celebrate them every month. We share those with our partners, our health system partners, to let them know, here are the moments that are happening within your ASCs. We share them with our organization, with each other. We talk about them. And I think that having that shared sense of, are we delivering on that mission? Are we able to, come back to that service and that care? And is it something that we really want to do because our culture is deep seated in that? I think that's what then will always lead to growth and profitability because we do the right thing, and we really focus in on the things that will get us there. Rather than focusing on the profitability, we're focusing on the things that will get us there. And so not only from an operating model, but from a goal set, as you say, if we're reaching these little goals along the way, these other success metrics, and we're hitting them, then the profitability will be there.
I love the notion of really recognizing and amplifying those moments that you're describing, because that's what experience is made of, right? It is a series of moments that help to drive and deliver that measurable outcome at the end. Of course, as we say at Tallwave all the time, we believe experience is everything. And of course, CX research and certainly stories like this are really sort of bearing that out. One last question I wanted to ask you about. I was reading a recent PricewaterhouseCoopers report on CX that showed that over a third of customers are willing to leave a brand that they love after a single bad experience. I think that it's a trend that we're all, I think, familiar with. Yeah. Clearly, Atlas is working to create an employee experience that drives the type of consumer experience and delivers on these types of moments that get you to your goal. But of course, we know that no organization bats 1,000 all the time. So I'd just love to hear a little bit about what strategies or game plans that Atlas is calling into play when things don't go right to ensure that you can still deliver on those values.
Yeah, it's a great point, and it's something that we look at, on a regular basis. And our partnerships, hopefully make it so that people don't want to have just one bad experience and throw up their hands, but two, certainly, why would you stick around if So we have a director of service integration, and this person is responsible for really looking at our service, not only to our physicians, but also to patients. How do we talk to our patients? How do we work with our physicians when they're in to make sure that we're providing that exceptional service every single time? And if we're not able to, because as you say, nobody's perfect, people have bad days, sometimes things are just completely out of your control, that we certainly experienced that a lot with COVID and having to pre-test patients. And if they came back as a positive, we couldn't let them move forward with their procedure. And that's, of no fault of anyone. So there are things that come up that either we've done something wrong or it's, out of our control. But in either of those scenarios, we take ownership. That's part of that value of having integrity. We own that experience, good, bad, or otherwise. And so our director of service actually has created an entire training program around service recovery. And not only does he go out to each of the ASCs and do these trainings on service recovery, but he also works with our support center here at headquarters to say, okay, what does this look like? A lot of times you can win someone back if you just acknowledge you're absolutely right? Telling somebody that they're right, that they shouldn't have had that experience, that we're sorry, genuinely we are. And it's not about just saying those things, it's about meeting them and then figuring out how do we ensure that it never happens again. So we have entire training protocols, and we have, somebody who's looking at that and watching it and taking that out. So that on the front end, you're providing exceptional care and outstanding customer service. But in the event that you're not able to, no matter what, here are the things that we do. Here are the set of protocols that we follow to own it, to apologize, and depending on what the situation is, those things will look a little bit different. But the fact that we have, somebody who owns that within the space and then goes out and makes sure that we're all operating within a standard set of protocols, of policy, of just language, and being able to follow that through, I think that that's incredibly illustrative of our commitment to that care and service, and making sure that if someone has a bad experience, we own it and we make it better.
And those types of proactive strategies are increasingly important. So thank you so much for giving us a little taste of what that looks like. And Thanks again, Dylan, for joining us today. This has been a really wonderful conversation. We've covered a lot of ground.
It has been. It's been fun, and I appreciate the opportunity, Jess.
Well, if you would like to learn more about Atlas Healthcare Partners, you can visit them at atlashp.com or check them out on LinkedIn. And if you're interested in learning more about TallWave and how we help companies design exceptional customer experiences, visit us online at tallwave.com or check us out on LinkedIn, Twitter, and Instagram. You can also read and download our recent research report, Data-Driven Insights into Evolving Customer Experience at tallwave.com/evolvingcx. Thanks again for tuning in, and we'll see you next time.